In this video, we are going to be talking about what you can expect on clinical. Stay tuned. Hey you guys, for those of you who are already part of the family, welcome back. And for those of you who are new to my channel, welcome. My name is Kiara Selena. I'm a new grad nurse. And on here, I show you tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. So if you're interested in having a smooth sailing nursing journey, make sure you click on that subscribe button down below and activate that bell button so you won't miss another video from me again. So clinicals are coming up and you really don't know what to expect. You are used to being in class, you are used to theory, or you're used to being in the lab and talking to dolls who do not respond back to you. But now you're going into this big facility where you're going to be speaking to real people and your heart is racing. Don't worry, we all had to pass through there. This is the way clinicals work for me, right? You're never really gonna be just thrown in there. That is not the way it's gonna work. And I think a lot of nursing students think that, you know, they're gonna come in and their teachers are just gonna abandon them and they're gonna have to do everything on their own and their teacher's gonna expect them to do everything perfectly. And that is not the way it is. Your teachers understand that you are learning. All the way up to my very last clinical before graduating, I still had questions. I still wanted my teacher to come in and review some stuff for me. Nursing is a field where you are constantly learning. You're constantly learning. Hospitals use different brands of material for different things. So you might do something one way in a hospital and get to another place and they use a different type of machine that you're not familiar with and you have to familiarize yourself with that machine. So don't worry, you're not incompetent, you're going to be fine, right? It is a learning process. In nursing, you are going to learn from the day you become a nurse all the way till the day you retire, and you will continue to learn new things even after your retirement. So don't expect to be perfect, and do not be afraid that your teachers are just going to let you go, because that is not the way it's going to be, at least if you have a good teacher. So you are going to come into the facility. Your teacher is going to give you a bit of a tour, you know, show you guys how to maneuver around the hospital. If you guys are in a very big facility, the teacher is going to kind of show you guys how to get around, how to find things and things like that. Once that is done, your teacher is going to probably bring you guys up on the unit that you guys are going to be on. You guys are probably going to meet some nurses that you guys are going to shadow. You guys are probably going to meet the head nurse. The head nurse is usually the one who kind of, you know, welcomes the nursing students and kind of just explains a bit of what the floor is like. The teacher will let you know what floor you guys are going on, but the head nurse kind of really gives you a good overview of, like, you know, what they do on a day-to-day basis. And once you guys do that meeting, your teacher is probably going to pick out some patients for you, right? Now, teachers do things differently. So on the very first day that you guys are brought up to the unit to see what the unit is like, your teacher may at that moment discuss with the head nurse what patients would be good candidates for the students, and then the teacher will let you know who your patients are, and then you will go in the charts, you know, learn about their past medical history, learn about their reason for admission, you know, learn everything that you guys need to know about that patient, so that the next day when you guys come in, if your teacher makes you guys go care for them right away, you guys won't just be going into the room blindly. Now, some teachers may not do it that quickly. Some teachers may bring you up to the floor, you guys do your whole meeting with the head nurse or whatever, and then the next day you guys come in, the teacher does a little bit more teaching with you, more reviews. For example, I wasn't admitted. I was not admitted, but I was sent to a rehab facility, and the floor that I was on was a floor for CVA. So a lot of the people who were on that floor were people who had strokes. And so the teacher wanted to do a little stroke review with us, you know, the signs and symptoms of a stroke, causes of a stroke, medications that treat strokes, you know, things like that. So the teacher did a day of teaching with us, a day of refreshing with us, because like I said, we do a year of theory and then a year of clinicals. So if the third system that you learned out of, you know, all the different classes that you have in nursing school, if your third class was cardiovascular, you know, and you haven't done cardiovascular up until your clinical, there may be little things that you forget, right? And the teachers are aware of that. So usually, sometimes they do a little review with you about the system that goes along with the unit you guys are on, and then on that day they will choose your patients and you guys will go over some stuff. Now, there are certain things that the teachers will let you do alone. Like the teacher is probably not going to come into the room if you have to do an AccuCheck or if you have to take vitals. For the AccuChecks, there's usually an AccuCheck training video that hospitals make students watch so that students could become familiar with the AccuCheck machine that hospital uses, and also the teacher will do a little review with you. If not, maybe your teacher will come in the room with you to do the AccuChecks, but for AccuChecks and vitals, the teachers usually don't really feel the need to come in with you because you practice that enough at school, and honestly it's pretty basic. So for your first, second, or maybe even up to your third clinical, your teacher is probably going to follow you closely, but I just want you guys to know that your teacher is not expecting for you guys to be perfect when it comes to procedures. In my opinion, I think the teachers are more evaluating your critical thinking skills, right? So you don't want to just collect data and run back to the teacher all the time. Obviously, for your first, second, maybe even third clinical, there's still some things that are not going to click, but after those clinicals, your teacher's really looking to see how you collect data, right? So if a person is post-op, right, and they tell you that they have, abdominal pain, you're not just going to run to the teacher and say, hey, the patient has abdominal pain. Or if the teacher asks you, what are you going to do about it? You're not going to look for a medication right away, right? The first thing you're going to think, well, post-op, they were under anesthesia for a long time, right? And when they come back, or when they're under anesthesia for a long time, sometimes they retain fluid. So the first thing you're going to do before you go tell your teacher that this patient has, abdominal pain, do a bladder scan first, right? Do a bladder scan. Maybe their bladder is full and maybe they have not urinated yet, and that is the reason why they have abdominal pain. Just a random example like that. But I think those are more the things that the teacher is evaluating, because your skills come with practice, right? And even though we practice our skills a lot in labs, the teachers cannot really control what procedures they're going to give you, because it's based on what the hospital has, right? So if nobody on the floor needs, I don't know, a peg tube, or if nobody on the floor has a peg feeding, right, the teacher can go over the machine with you, but you can't really practice on a person because there's nobody who has a peg tube, right? And sometimes you can go through all of your clinicals without practicing a certain skill, and you have to kind of learn it on your own even after you graduate and you start working in the real world. So like I said, nursing is a field where you are constantly going to be learning. It doesn't matter if you have 20 years of experience or 1 day of experience. I don't want you guys to stress or think that you guys have to be perfect. That is not what the teacher is looking for. I don't think so. If you guys want to look at my video on how to ace your clinicals, I made a video about that, and I also shared a sheet, an evaluation sheet that I was able to get, where that has a checkoff list of exactly what my teachers were looking at when evaluating us, and I think it's pretty standard everywhere. So if you guys want to go check that out. But don't think that you guys have to be perfect. That is not the case. You guys are going to make mistakes. The teachers understand that. The main thing is your critical thinking skills and making sure that your patient is safe. Remember the little things. Put the bed down. If they have glasses, make sure they have their glasses. If they use a walker, make sure their walker is around, because if you forget the bed up and the patient falls and the teacher knows that you're the one who left the patient up, you can fail for leaving your patient in an unsafe environment like that. So remember, safety first, and everything else will just come after.